Hello friends, this is Sudharshan, and in this episode we will talk about the most important disease of uvea, that is your anterior uveitis or iridocyclitis. So as the name suggests, it is the inflammation and infection of the iris, the ciliary body and the uvea and other associated structures. So when it comes to the etiology, we can divide it into infectious and non-infectious. So when it comes to the infectious, we can have bacteria, mostly staph, strepto, pneumococcus, gonococcus and rickettsia. Viruses, herpes, CMV and AIDS. Fungi, we can have aspergillus, candida and its mycosis. Parasites, we can have toxoplasma, onchocerca, etc. Non-infectious, we can have hypersensitivity reactions, autoimmune diseases, systemic diseases, etc. So when it comes to the signs and symptoms will be same: foreign body sensation, that includes photophobia, irritation, itching, lacrimation, reflex blepharospasm. So when it comes to the signs, let us see the most important signs first. So the most important signs will be the festooned pupil, where the pupil is irregular, and then KPs, keratic precipitates, will be seen. Then apart from that, the circumcorneal congestion along with the segmental posterior synechiae. These are the four important cardinal signs of anterior uveitis or any kind of uveitis. Then let us see about the KPs, keratic precipitates. There are four types: mutton fat, where it will be greasy and waxy; small and medium, which will be, as the name suggests, small, discrete and dirty white. But what is the most important difference here is that caseating granulomas will be seen in the small and medium type. Red indicates blood, so hemorrhages. Mostly herpes is the reason, or a CMV, which causes CMV retinitis, and old will be because of healing or cicatrization. And in anterior chamber we can see hypopyon, pus collection, hyphema, blood collection, along with aqueous flare cells. Then in the iris, if we go into the structure one by one, I'm saying, in the iris we can have iris atrophy, mid-dilated pupil, functional iris bombay. It can lead to angle closure glaucoma sometimes. Iridocorneal angle synechiae can happen. The color of the iris can change, because of which the pupil can become jet black sometimes. But there are two important nodules in the iris: Kopi and Busaka nodules. So Kopi nodules are the posterior synechiae, and Busaka nodules represent the collarette. And next about the pupil, as I already told, jet black pupil might be seen in some cases, but mostly festooned pupil will be there. There can be ectropion and entropion as well. And if there are synechiae, there will be a traumatic cataract because the iridocorneal angle is closed and the aqueous humor has to hit the lens automatically. So that's why it can lead to a traumatic or complicated cataract. And then the anterior uveitis can complicate into the posterior uveitis. Some important structures, like if it's the vitreous, posterior vitreous detachment and hemorrhage can happen. If it is the retinochoroidal membrane, there can be a tear, Paton's lines we call it, because of which papilledema comes. Papilledema leads to ICP getting increased. Then apart from that, optic disc and nerve can undergo atrophy, asymmetry, pallor, hyperemia, hemorrhages, blurring of disc, and there can be Marcus gun pupil. There can be color vision, visual acuity decreased, visual evoked response decreased, electroretinogram and oculogram will be subnormal, then fundus fluorescein angiogram and optic coherence tomography will be subnormal. So these are all the clinical features. So it will be based on what structure will be present in the eye. So diagnosis in general, we can do a hemogram, labs to evaluate the systemic conditions, immunoglobulin and C3 levels can be checked if complement disorder, most commonly hereditary angioneurotic edema is said to contribute. Then urine, blood and stool examination. Then we can do a chest X-ray, CT MRI, X-ray or CT PNS, X-ray bones. Then we can do biopsy or culture for the infection. And treatment in general, the medical management, antibiotics, analgesics, antipyretics, steroids, cycloplegics like pilocarpine, immunosuppressants like cyclosporin A and tacrolimus, and anti-glaucoma drugs also can be given. Apart from that, hot fomentation and sunglasses can also be prescribed. Surgery based on what part is affected. Lens affected, cataract, extracapsular extraction. If entire eyeball is affected, because it complicates into a endo or panophthalmitis, entire eyeball can be removed. Enucleation or evisceration can be done. Retina is affected, so we will do laser or pan-retinal photocoagulation with cryotherapy. If vitreous is affected, pars plana vitrectomy with a vitreous substitute. So that is all about the most important topic of the uvea. So thank you so much. We will see in the next lesson.